at the very beginning of my career, I knew I wanted to work on public policy, and I knew I wanted to be in Washington, D.C., and that's where I first got exposed to healthcare policy. I, I know that a lot of policy issues are complicated, but healthcare really is the trickiest and most complicated because you really have to understand tax policy, tax expenditure programs, labor policy, health insurance, market regulations. And there are so many moving parts that it makes it very challenging. And I love a challenge, and I think that's why I'm really drawn to healthcare. So the Goldwater Institute has a very strong reputation for being extraordinarily solid on policy. And I think that was really missing in a lot of the healthcare debate that was taking place both at the federal and state levels. While our side, had great ideas, the strategies were not so great in many cases. And I think that I really felt like I could have an impact in helping nationally through replicating successes in Arizona throughout the states in really making a difference in impacting healthcare access and affordability, something we all agree on, but for which, I think a lot of times the victories are too few and far between. So most immediately, we've got to address rising healthcare premiums and really address, those individuals who are being priced out of the health insurance market. We've had, of course, the Affordable Care Act, which was aimed at creating healthcare access and affordability, but I think many of us knew that that was not going to be an effective solution, and it turns out that that was in fact the case. So now we're left with not only repairing the damage of the Affordable Care Act, but also moving forward to really create a sustainable, affordable, accessible healthcare approach, because we really didn't have a great system before the ACA. And so, there's a lot of work to be done, a lot of heavy lifting, but that really is, I think, the forefront of a lot of Americans' minds and concerns at the moment. So much of healthcare is driven today by the news headlines and what Congress is going to do or not do on the Affordable Care Act. But I think thinking longer term, it's really important to realize that we are at a historic moment in terms of healthcare and medical advances. And this is the area that I'm most excited about and actually quite optimistic about in terms of accessible and affordable and customized healthcare solutions for every individual. I look forward to breaking down the barriers that are stifling innovation in the healthcare area and that are really going to, I think, transform what healthcare means in the future.